Thank you. Good morning, everyone. How's everyone doing?
Good morning.
So we're here today to start the City of Laredo Blue Ribbon Committee for People with Disabilities meeting. Today is Wednesday, August 18th. And so I'd like to start by first making sure that we are calm. And next thing we do is, second item is to review and approve the minutes of July 21st, 2021. You should have your minutes on the right-hand side. Changes, revisions, let us know. Corrections.
I'm missing all this. The agenda. The minutes for July. Oh, they don't come. Thank you.
Any changes, revisions, corrections?
The correction, it's the Texas Council.
Okay, thank you. If that's the only correction we have, I someone to motion to approve the minutes.
I'll put it in.
I need someone to second it.
I second it.
Next item is the public comments.
Mr. Chair, no one second.
No one's on that, okay, so unless there's public comments within the group. No, okay. Let's go to item 4, is discussion and possible action for the next steps regarding report from Christine Reyes regarding the special needs program. Christine?
Yes. Good morning, everyone. I have quite a few bullets. I'm gonna let me know if you have any questions. The program for children and adults with special healthcare needs participated in several outreach events this last month. We participated in the Back to Health, Back to School Health Fair, where we were able to assist 4 new families and offer services. And we participated in the Operation Lone Star event. We were invited to offer educational information and offer FEMA resources that our program receives. There we were able to assist 6 new families. Our program continues to participate in live webinars and connect with state contractors in regards to emergency preparedness and transitional health services. This last month we attended Emergency Preparedness Be Ready, Red Cross Ready, Transition to Adulthood Learning, ADA reestablishing ADA standards for accessible design for play areas. And here we go, tips for establishing back to school routines. These were all great webinars, and we created social media flyers to assist parents through our platforms on information and tips that we gathered through these webinars. A series of Caregiver Burnout was provided through our social media platform. There were 4 different videos, and we offered information on signs and symptoms and resources for Caregiver Burnout. During the series, I received 14 new referrals on this resource. Our program continued to offer water safety throughout the month of July and August. During the month of June and July, our program attended the state live webinar for water safety. We continue to use these resources because I believe on the last meeting I did mention that unfortunately there was a drowning during the month of June or July. So we're going to continue giving off this information because I still believe since the weather is hot, there might be some aspect of wanting to continue to go swimming. So we're going to continue to offer water safety information for families. Our program collaborated with Healthy Living Program with 6 new cooking recipes, and through the harvested vegetables through the therapeutic garden, we continue to assist in the cooking videos and the resources shared with the families to improve on practice motor skills, communication skills, and independency skills. Educational information that was offered, we provided the 31st anniversary for ADA, which was in July. We offered information on how ADA has provided success in college and how ASL interpreters shared with and the education information on what is a medical home, what is a healthcare transition, information on emergency preparedness and tips, information on respite care, and information from our program and Title V performance measures for our program. For the month of September, we are reporting our 4th quarter for the fiscal year of 21, and we're beginning a new program year. The month of September, we're currently working on another burnout series for the month of September, which also highlights National Suicide Prevention Month. And we're also recognizing the Emergency Preparedness Month. So I'm currently working on a proposal that will help us collaborate with the fire department and our own epidemiology department. And once we get more information on the approvals or what type of event, I'll share it with the committee as well as our community. This month, our program was able to assist a total of 59 new families. 35 families were provided and received emergency funding through a form of an HEB gift card, and 24 families were provided referrals to local and state resources. These referrals include food banks, community development, which is the rental and mortgage assistance that we have, and healthy living program information.
I have a question. What was was the amount of folks that attended Lone Star? Do you all have a number? 1,000? Wow, not too bad for the times that we're in. Much lower than past years, I'm sure, right?
We did have some challenges due to the location. There was decrease in size of the facility that we had to use this year. And of course, because of COVID, there was a lot of apprehension of actually coming out, but we were able, these were all free services for Operation Lone Star, which included medical, physicals, dental, and of course, this is in conjunction with the Texas State Guard. So,
Well, good.
It was a really nice event.
Sure.
There was an area for health education where I was posted, but there was like Erica had mentioned, they collaborated with Texas A&M, and they had students there also experiencing and giving information and resources on nutrition.
That's great. Hey, on the HEB cards, so you still have HEB cards available or no?
We
You're qualifying.
for the fiscal year 2022, which starts in September, we submitted an application to the state for additional state emergency funding. We were approved. It just depends how many and how much of what we can put in a gift card. We're going to decide in the month of September, and we'll know for September to August of 2022 to 2023, we'll have an X amount of gift cards being able to provide for families.
That's great. And I'm sure you'll bring those numbers to the next meeting, right, in
Yes.
September? And that way the folks know, because that's amazing. I remember we referred some folks to obtain that assistance, you know, for those individuals who are having a hard time and qualify, or, you know.
Yes,
So-
in January, they opened the application. We did apply right away, and we were able to get awarded an additional
That's
$25,000.
good. Thanks,
So
Christine.
currently the card is valued at what?
I'm sorry?
The card is valued at what?
Each card, as far as from what we've started from September to now, each card is $100. Yes,
And you're only eligible once?
once a year, yes. New Year comes, we do encourage new clients to come in, because we
Sure.
might miss gaps here and there, but we try to work with outreach on that. But if a familiar family, which is our previous clients from the previous year, do need the assistance next year, the state is willing to help.
Thank you.
Okay. Your water safety, you don't provide. Those are really tender, and how does that work?
The state currently connected us with a nonprofit in Austin. Unfortunately, well, it's unfortunate but fortunate that this nonprofit went through a death in their own family where their child that had a developmental disability passed away. So they derived their nonprofit out of water safety resources for other families to learn and educate themselves. So the state brought them on board to one of our webinars and our trainings, and we received free educational information from them. I did pass on the information to my supervisor in regards to possibly having this nonprofit as a vendor, because they do provide packets for families that offer the water safety and resources for kids, just to make it easier to learn, especially if they have a developmental disability. So we're working on that process, that hopefully by next year we do have them as a vendor and be able to provide their resources. But we're also continuing working hand in hand with them to offer us educational resources to provide free for families.
So does the water safety also provide or teach the kids how to swim?
No, we are currently working on getting more information on adaptive aquatics. I do need to submit more information to the state. It is under our program, but since the City of Laredo Health Department has its own plan already and programs set with the state, if we were wanting to go outside the work plan, we would need to request the state if we have approval, and also from our director. But it wasn't in the plans to submit for this next year on information on how far we can get with adaptive aquatics. Once we get, if we can get adaptive aquatics in our local government, or like within another division or here at the health department, we would work on water safety, for instance, swimming lessons, having a lesson of water safety at a location, so we help teach parents and help teach the child or the young adult on safety precautions they need to take. But of course, it's a process. So right now, what we're working on is the proposal to see if we're allowed or we're giving the approvals to start working on an adaptive aquatics division or program.
Thank you. Okay. Any other questions or comments anyone would like to make? If not, we can move on to the any other additional services as a result of or in response to the COVID-19 pandemic? Nothing? Okay.
I just, from the, oh, sure, go ahead.
No, go ahead.
Okay, from our last meeting, I wasn't able to announce it, but we were able to provide a summer camp for special needs children together with South Texas Development Council. They called us 2 weeks and they said, we have some funds, we need to apply, but we need to, do this in the next 2 weeks. So we put together a summer camp, and I did reach out to Christine to see if let the families know. And this is more of a respite service for the parents of these children who, as you know, with special needs, sometimes are very involved, and the parents don't really, I shouldn't say trust, but they want to leave their children with people that know that, or individuals that have the background and that know special needs children. So they count on us to be able to do that. So we had a 2-day summer camp for them with many activities. Usually we go all out, and it's usually a week, and we provide for like 35 children each day. This time we were only able to reach out to a certain family, so we had like 15, but they had a great time. The parents really appreciated that they were able to drop off their kids for the whole day. It was Thursday and Friday, and they were able to get to go with their other children to get registered or pick up clothes. This is time that these parents don't usually have because they have to stay with their child, or they go with their aunt or something because the mom can't go with them at times because of the involvement. So we do hire extra staff, LVNs, to be able, if there's tube feeding or diaper changes. So it was very successful. They had a great time. And so hopefully we're going to be planning one for October, and then one in December, but I'll let you all know a little bit more about that as they give us the information.
So you said diaper changing, so what age are they?
They range from 5 to 12 years old, but some of these children are in a wheelchair, they're involved, so we're able to do that, and the parents leave. Some of these parents are people that have been with us for the past 2 or 3 years. We weren't able to provide a summer camp last year, so they were very excited that we were able to this year.
That's
More limited, but with less activities, but in the past, we've got like the border patrol go in, they take the horses, they take the motorcycles, and then we had puppet shows, we have Lizzie, the famous artist here in Laredo, they do artwork with her, just different things that we do with them, and the parents sometimes, stay there with them. And we have the facility where we have our kids zone where we have a great time. They have a lot of things there to do and, work on, get out. They were happy they were able to get out in a safe environment. So we're happy to provide.
great.
Okay, well, I just know there's going to be questions, and I wish I had better answers for you. But in terms of COVID vaccine, I know there's some talk about potential boosters. We are pending guidance from CDC and, our contacts at the federal level to see how we are going to roll out. And of course, also the pending approval for children, I believe it was 5 to 12 that are pending to be vaccinated. I know there's a lot of concern with back to school and the increase in cases. Of course, Mr. Chamberlain is addressing that right now. Actually, that's why he cannot attend, and I apologize on his behalf, but they reinstated the media briefings, which conflict with this committee meeting. So you're welcome. They do them weekly, so you're welcome to log into those where information is provided in terms of things like anything else with the pandemic changes on a daily basis. So we're just waiting for that to see how we roll out, but we'll keep you updated.
Which brings me to a question I was going to bring up. I think that when the city council got together and made a decision to bring us back, made it mandatory for us to meet on a monthly basis, we were seeing a dramatically or significantly, and we're either at the same level or even worse than we were in the past. Okay? So I guess my question is the city still going in that same direction, or are they reconsidering these meetings? Because I've noticed, one in this room has taken off their
I
mask.
had a feeling you were gonna ask that. So, we did reach out to city secretary with, this question along with some other ones. It looks like they were approving some sort of hybrid, model, but effective, I believe, September 1st. You remember, Bona? It was September 1st, right, not the end of the month. We are on track to have them mandatory in person. Already addressed with city secretary that the commissions and committees do have a concern about being in person. So, we've kind of planted that seed about reevaluating their stance.
Correct. Yeah, because I think that the decision was made based on the first variant, okay, and that has changed, and so we're under siege from another one now, different one, and so it's allegedly it's much more contagious and moves much faster, and even if you're vaccinated, you're susceptible to it as well, and so I'm asking on behalf of the group because I know I'm glad I get asked or was asked about this again. Okay, and so.
We know it's a concern, and of course, we're trying to exercise all safety measures, hand sanitizer, mask wearing, vaccination, of course, is one of the best preventive measures at this point. But we continue to evaluate it, and like I said, your concerns have been brought up to city secretary.
Okay, thank you. Okay. I guess we can move on to the next item, which is discuss city ordinance. This is the implementation of the face-to-face committee meeting. I guess we just discussed that. The only thing that was left pending was with regard to those who attend via electronically, if that attendance is going to be.
I believe it's valid through September because they were allowing that hybrid model of,
Okay.
so they do, they are included as part of the quorum.
Okay.
September what?
First. September 1st. Again, if anything changes, we'll go ahead and relay that information via email to the committee.
Which doesn't help you guys because we're in August. So
Now you understand.
So, no, you know that. Okay. The next item has to do with removal of members not meeting the attendance requirement. I know that there had been some discussion about there was at least one member who had voluntarily indicated that he could no longer attend. And so we ourselves cannot appoint people or to this committee. So I think that the next item that we were going to bring up was if we ask the mayor or do we provide him with a recommendation of who he would like to replace that individual with, if at all.
Right, so the committee can provide a recommendation to Mr. Chamberlain. Mr. Chamberlain would bring it up to the mayor and the city council. And once that's approved, it could be placed on the agenda for the appointment. So you are more than welcome to, I mean, of course, it would be a discussion amongst the committee, and then your recommendation would be brought up to Mr. Chamberlain.
All right. Just wanted clarification about how to go about what is the process. Okay, so yes, okay.
And I did receive additional clarification on the attendance and automatic, how they call it is automatic forfeiture. So after the 4 absences, excused or unexcused, whether they're consecutive or not consecutive within the calendar year, it is an automatic forfeiture. We don't receive anything from city secretary. It is the committee's responsibility to advise that member that they're automatically removed as a committee member. Of course, these are public meetings, so they're more than welcome to continue to join when their schedule permits. but in terms of being an actual member.
So there are no excused absences,
No.
period, that's it.
Correct.
Okay.
So just to provide that, and I have it in writing if you want to see it.
No, that's fine, I think the group needs to know what they're up to, you know, that-
And I mean, every effort was made. I know, there's been special circumstances. If I'm completely candid with you, I did ask them, like, what other avenues do we have for members? What do I advise them if they want to continue to serve, or if the chair, if the committee agrees that they want the members to continue? Their blatant response was, the ordinance is the law, and we have to follow the law.
That's fine.
Yeah,
That's true.
that's fair.
Okay. We had spoken last time regarding the creation of a service community resource manual, and there was discussion that it was potentially already in existence. And I don't know just how I can do it, and just go and
Yes, I went to United Way and spoke to Liz and gave me a copy of. This one is old. They did is 2012. The reason they stopped doing it is because they're saying the 2-in-1 is done, it's local and national.
Yeah.
So, it provides more information than what they can put here. So, but they gave me, some brochures, if y'all want to take some for your clients, or if you, want to pass out and let them know that they can,
I'll do one.
I have a question, where can you secure a copy of that document?
United Way, they just had a couple. But I don't know if
But it says you still have resources.
Do they have it online? Do you know if that?
but she just said just 2-in-1, they have everything there.
which is really inconvenient, like when you're a service coordinator or a case manager, and your client says, I need this or I need that, or even when I express the need, but you don't know, can go back to the manager and say, you know what, we have something here, and see, I can do it. And that's how come I was asking about this manager. Because in spite of the fact that you've got excellent service coordinators and case managers, they don't know all the resources, it's impossible for them to know everything.
Yeah, but I've called 211 before and they have my mom and you tell them what they need and they provide you the number.
So you ask them, I need help with this?
Yes, what are you looking for? And you tell them, oh, okay.
And they give you the eligibility requirements also?
No, they connect it to that resource. It's only like the middle person.
But that's very helpful, something like that, who's digitizing would be excellent. And I say that because when, during COVID, I contracted with the state not with an outside agency, and they were looking for resources, and we had to dig our own resources to be able to get that, because we didn't have access to anything like that. So that's why I was saying that. And even now, the state called me up and said, can you provide me the resources you used? So I compiled everything, sent them over, and I'm talking about little towns and stuff like that. So I think it's very helpful.
My,
So there's
my
like- there's like-
experience
Go ahead.
these last couple of weeks, especially with school starting, I know I've had several families that reached out to me with multiple issues. So what I would food assistance, including mortgage and rental assistance, so some families did have multiple needs, so I would get that information and provide it to them. So it really is helpful, especially when we have 211, but sometimes they need multiple assistance with different organizations. So 211 has been able to assist me, especially with the state program that we have once we have them directed to caseworkers.
And you'll see that it's local and out of town.
National.
Yeah,
it's
It's national. It's national too. I didn't know that. That's good to know.
Yeah, there's a large array of services here that cystic fibrosis, J camps, the consolidation, I mean, because you're looking at it, you say, oh, I didn't know it existed.
Right.
But on your own, you say, well, I'm overwhelmed with my debt, you're like, let me get you some money, but that's not like the point. Is it there's somebody who's actually teaching them how to consolidate their stuff. So, okay.
Thank you.
No, now we're
That's tangible.
Mr. Pastor, now we're gonna ask you to make copies.
It is a good.
Maybe scan, right?
Yeah, but not if it's 2012.
No.
Well, they only really get right now, but
Yours is not
They're just doing, through the.
So
computer.
they're not doing updates, because they used to call it the agency, and that's what the programs you
I've
have.
been here long enough to know that they would do that. I remember getting that, but not anymore, yeah.
wow. Wow.
Okay, so Ms. Lara, please, do they give it a...
Give it A plus.
Great.
It's good information.
Well, thank you for that. I was expecting a manual, but not an encyclopedia. Anyway, I appreciate that.
I did ask her for some other ones, but she said, oh, we don't have them, so I have this one.
This one's on loan. Anyway, I don't find any other announcements that anyone would like to make. Okay. I would, is Tiffany. Yes. So, you're an employee here at the
Health department, yes. I've started
sales
2 weeks
department.
ago.
Good. Congratulations and welcome. We're a fun group, we're not so serious.
Yes, I'm enjoying your meetings so far.
Okay, the next item is just adjournment. I don't know if you would like to motion to adjourn the meeting, and we can conclude it unless anyone else has some last words to say. No?
I guess I do want to say something. It's so good to see people that you have missed for a whole year. I know we've had, I know, right? It's that human touch, it does make a difference. It does make a difference. So.
When I was a child, many years ago, okay,
A few years.
I remember there was a singer, his name was Rafael, he was from Spain.
Mm-hmm.
He's very dramatic. And Espanol, okay, and he came to Lauderdale, okay, and I remember the announcements in the radio used to say, "Carne viva en la cueva leonística." Carne viva, so estamos aquí en carne viva. Okay, another comments, okay?
I have an announcement. For eligibility, as far as the basic living requirements, because there's a certain amount that you can make after that. It doesn't impact your eligibility, but it impacts what services you might be requested to assist with. So for FY22, which is September 1st, 21 through August 31st, 22, the BLR has been increased to 300% of the basic living requirement. So we're trying to capture those, maybe the higher income families that have been impacted by COVID, and still working to assist them without them having to contribute. So that begins on September 1 as well.
If I may add to that, I think, correct me if I'm wrong, I think now people can self-refer also. Is that correct online?
Oh, yeah, the
Yeah,
VR.
they have the self-referral online now.
Yeah.
That's good to know.
So, just wanted to add that.
Thank you.
That was under B, so I'm adding it here.
So there's nothing else. I'd like to thank all of you for being here, taking the time. I appreciate it.
Thank you.
Thank you.
Thank you.
Lucille, thank you.
Thank you.
Thank you, Ms. Paola.
No, you're welcome. Thank you. Motion to adjourn? Did you motion to adjourn? Did you motion to adjourn?
I did, but nobody was. I make my motion on the side, my second.
Wow, second.
Yes.
Thank you.
Thank you.
Have a-
It's very quiet.